She's 46. She's been going to the same dentist for 11 years, brushing and flossing exactly the way she always has. Nothing about her routine has changed. But over the last few months, her gums have started bleeding when she brushes. Not a little, but enough that she now checks the sink before she checks the mirror. Some mornings, her tongue feels like it's been burned by coffee that was never actually hot. Her favorite meal, the one she's cooked 100 times, suddenly tastes faintly metallic, like she's been chewing on a coin. She mentioned it to her doctor, who focused on her hot flashes and her mood. She mentioned it to her dentist, who focused on her brushing technique. Neither one connected it to the other, and neither one connected it to what was actually happening in her body. If parts of this sound familiar, you're not imagining it, and you're not alone. You know the perimenopause symptoms everyone talks about: hot flashes, night sweats, mood swings that come out of nowhere, periods that no longer follow any predictable pattern. You've probably read the lists, watched the videos, maybe even kept notes to bring to your doctor. But there is an entire category of perimenopause symptoms that almost never makes it onto those lists, and they are showing up in one of the most overlooked places in your body: your mouth. In this video, we're going through 7 of these hidden symptoms, the actual biological mechanism behind each one, and what genuinely helps. All backed by clinical research, not guesswork. By the end, you'll understand why your mouth has been changing, and more importantly, what to do about it. Let's start with the most common one, and the one most likely to catch you off guard. Number 1. Bleeding and inflamed gums. A scoping review of oral changes during the menopausal transition found that periodontal complaints, problems with the gum and supporting tissue around the teeth, were reported by as many as 60% of women going through this stage. That makes it the single most common oral symptom of perimenopause, more common even than some of the classic symptoms you already know to expect. Here's the mechanism. Estrogen plays a direct role in maintaining blood flow and collagen production in your gum tissue. Collagen is what gives that tissue its structure and resilience. Think of it as scaffolding. As estrogen declines, that scaffolding weakens, blood flow to the gums drops, and at the same time, your immune system's inflammatory response becomes more reactive to the same amount of plaque it used to tolerate without issue. The result? Gums that bleed with the exact same brushing routine you've used for 20 years, not because your hygiene changed, but because the tissue underneath it did. Number 2, burning mouth syndrome. This is the symptom most women have never even heard the name of before it happens to them. It's described clinically as a burning, scalding, or tingling sensation, most often affecting the tip and front 2/3 of the tongue, occurring without any visible sore, injury, or infection to explain it. That absence of a visible cause is often what makes it so unsettling. Nothing looks wrong, but it feels like something is. Research shows burning mouth syndrome affects somewhere between 10 and 40% of women during the perimenopausal and menopausal years, depending on the population studied. One proposed mechanism involves the trigeminal nerve system, the nerve network responsible for sensation across your face and mouth. Estrogen appears to influence how this nerve system processes pain signals, and researchers have found that postmenopausal women with burning mouth syndrome show heightened tongue sensitivity to thermal stimuli, meaning their nerves are, quite literally, registering normal sensations as pain. This isn't in your head. It's a documented, hormonally influenced neurological symptom. Number 3, taste changes, including a metallic taste. Estrogen helps maintain the taste receptors on your tongue and the oral tissue that houses them. When estrogen declines, some women notice food tasting different, flatter than it used to, oddly metallic, or simply off in a way that's hard to put into words. This symptom has a clinical name, dysgeusia, and it's frequently reported alongside dry mouth. Researchers believe the two are connected. Saliva acts as the transport medium that carries flavor compounds to your taste receptors, so when saliva volume drops, taste perception drops along with it. One clinical review estimated that roughly a quarter of postmenopausal women experience dry mouth severe enough to affect how food tastes. Number 4, dry mouth or xerostomia. If you watched our previous video on this exact topic, you already know the depth of what's happening here. But it's worth revisiting briefly because of how central it is to this entire list. Estrogen receptors line your salivary gland tissue, meaning estrogen directly regulates how much saliva you produce and how that saliva is composed. As levels decline, somewhere between a quarter and half of perimenopausal and menopausal, women experience measurable dry mouth. This single symptom acts almost like a hub. It worsens bad breath, accelerates cavity formation, and, as we just covered, dulls your sense of taste. If you take away one thing from this video, it's that protecting your saliva protects almost everything else on this list. Number 5, increased tooth sensitivity. As estrogen declines, so does bone density throughout your body, including in your jaw. At the same time, the gum recession caused by reduced collagen support, which we covered under Symptom 1, begins exposing more of the sensitive root surface of your teeth, the part that was never designed to be in direct contact with hot coffee, cold water, or acidic food. The combination of these two changes, bone density loss and gum recession, is why so many women in their late 40s and 50s suddenly develop sensitivity to foods and drinks that never bothered them before. Number 6, a shift in your oral bacteria. Hormonal change doesn't just affect your tissue, it changes which bacteria thrive inside your mouth. Reduced saliva flow, combined with the hormonal shift itself, creates conditions that favor harmful, cavity-causing, and gum disease-causing bacteria, while the beneficial bacteria that normally keep your mouth in balance decline. This is a large part of why so many women in perimenopause suddenly develop cavities in places they've never had a problem before, despite changing absolutely nothing about their oral hygiene. It isn't a discipline problem. It's an ecosystem problem. And the ecosystem changed underneath you. Number 7, jaw pain and TMJ symptoms. Some women notice new or worsening jaw tension, clicking, or pain during this transition, a condition broadly known as temporomandibular joint, or TMJ, dysfunction. Emerging research on estrogen's role in joint and cartilage tissue suggests that hormonal fluctuation may specifically affect the cushioning tissue inside the jaw joint, altering its structure and function. It's a less commonly discussed symptom, but it follows the same underlying pattern as everything else on this list. A joint that functioned normally for decades suddenly behaving differently, in step with a hormonal timeline, not a mechanical one. Here's what ties all 7 of these together, and it's the single most important thing to take from this video. None of these are separate, random problems. They share one root cause. A 2021 observational study following perimenopausal women specifically found that oral sensory complaints, dry mouth, taste disturbance, and burning mouth, didn't occur in isolation. They clustered together, appearing in the same women at the same time, and their severity was directly associated with the overall severity of that woman's broader menopausal symptoms. In other words, if you're having a difficult stretch with hot flashes, sleep, and mood, there's a real measurable chance your mouth is having a difficult stretch too, even if no one in your life has connected the two for you. And that disconnect is precisely the problem this video exists to close. The same research found that while the large majority of physicians reported encountering these exact oral complaints from their patients, a meaningful share of those women were never referred anywhere for care. Oral symptoms of perimenopause fall into a gap between medicine and dentistry. Your physician isn't trained to examine your mouth in this kind of detail, and your dentist isn't typically asking about your hormonal stage. The result is that women are left to either explain it away or quietly live with it. So, what can you actually do? First, name it specifically at your next dental visit. Not "my gums bleed sometimes," but "I'm in perimenopause and my gums have started bleeding more than they used to." That one sentence changes how your dentist interprets what they're looking at and moves the conversation from a routine hygiene lecture to an actual hormonal explanation, which changes the treatment approach entirely. Second, prioritize saliva support, because it sits underneath so much of this list. Consistent water intake through the day, rather than large amounts infrequently, avoiding alcohol-based mouth rinses, which are actively drying to oral tissue, and using xylitol correctly. A brief window of stimulation followed by rest, which we covered in detail in our previous video, all help protect the saliva you still have. Third, be gentle. A soft bristled brush and a lower abrasion toothpaste matter more now than they did a decade ago, because inflamed, hormonally sensitive gum tissue responds poorly to the same firm brushing pressure you may have used without issue for years. And fourth, this is the step almost every woman skips. Track your oral symptoms alongside your cycle and your other perimenopause symptoms. A simple note on your phone, logging when your gums bled, when the burning sensation appeared, when taste felt different, converts a vague sense that something is off into real, specific data you can bring to your physician or your dentist. That data is often the difference between being told, "That's just aging," and getting an answer that actually fits what's happening to you. Your mouth was never separate from what's happening in the rest of your body during this transition. It was simply the part almost no one was trained to look at. Now you are. If this helped connect some dots for you, subscribe. This channel exists to translate exactly what's happening in your body during midlife into information you can actually use, one overlooked symptom at a time. Any information on this channel is provided for educational purposes only and is not intended as a substitute for the advice provided by your dentist, physician, or other healthcare professional. You should not use the information on this channel for diagnosing or treating a health problem or disease, or prescribing any medication or other treatment. You should always speak with your dentist, physician, or other healthcare professional before taking any medication or nutritional, herbal, or homeopathic supplement, or adopting any treatment for a health problem. If you have or suspect that you have a medical problem, promptly contact your healthcare provider. Never disregard professional medical advice or delay in seeking professional advice because of something you have learned on this channel. Information provided on this channel and the use of any products or services purchased by you on affiliated sites does not create a doctor-patient relationship between you and any of the physicians affiliated with this channel. Information and statements regarding dietary supplements available on this channel have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.